Have you ever looked at a red, swollen area on your leg and thought, does this look infected? That's a super common question, especially when you're worried about something like cellulitis. Today, we're going to break down what cellulitis is, how doctors figure out if you have it, and what the treatment involves. We've even got a special guest, Dr. Tom Warren, an infectious disease specialist, here to help us out. Welcome, Health Protocol. Thanks for having me. What is cellulitis? Cellulitis is a bacterial infection of your skin and the tissues just beneath it. Basically, bacteria get into your skin, which, by the way, is your body's largest organ, and cause an infection. So, what does it feel like? It does hurt. It's typically red, inflamed, swollen, and painful. Those are your main symptoms. When you see a doctor, they'll examine the area and confirm it's red, tender to the touch, and often has a fairly sharp, clear border of redness, though not always. You might be thinking, where do these bacteria come from? Well, our bodies are constantly covered in bacteria. Most people don't even realize it. What happens is that when your skin's protective barrier gets compromised in some way, maybe due to a medical condition, a cut, a blister, or even athlete's foot, those bacteria can get in where they're not supposed to be. You don't always need an obvious break in the skin to get this infection. So, you don't necessarily have to cut or poke yourself to develop cellulitis, though often that's what triggers it. Sometimes, it can just appear without any clear injury. How is cellulitis diagnosed? When you go to your doctor, say, with a swollen red ankle, how do they diagnose it? Are there specific tests they do? Usually, there aren't any specific tests. We typically rely on the clinical signs and symptoms. So, if you have a red leg, usually just on one side, and it's painful, and the redness doesn't go away when you elevate your leg, those are the key indicators for treatment. That last point about elevation is important because many older adults have issues with their veins, leading to chronic swelling, edema, or even lymphedema, which can make a leg look red and swollen all the time. If you lift your leg and the redness and swelling significantly decrease, it's likely not cellulitis. That's right. I remember once getting called to see a post-operative patient because the nurse suspected cellulitis. I went up, and with just a towel and some water, I wiped off the red surgical prep we'd used. Problem solved. I looked like a superstar. Since there aren't specific tests, is there any point in swabbing the affected area? In hospitals, we tend to swab everything when we're unsure. I'm sure Dr. Warren often thinks, please just stop swabbing so many things. No, swabs of the skin or even superficial wounds usually aren't helpful. So, it's generally not useful. Treating cellulitis. So, cellulitis is a bacterial infection. How do we treat it? The most common treatment is with antibiotics, often penicillin or its derivatives, because the most common causes of cellulitis are Streptococcus species. So, doctors don't usually need to identify the specific bacteria. They can make an educated guess. Over 90% of cellulitis cases are caused by common bacteria, like Streptococcus. Can these antibiotics be taken as pills, or do they always require an IV? It depends on the severity, but it can be treated with pill antibiotics. So, if it's a mild to moderate case, pills are often enough. If it's very severe, or not improving with pills, then you might need IV antibiotics. How long is a typical course of treatment? Usually about 7 days. Again, if the infection is more severe, or there are complicating factors, like a wound in a diabetic patient, then the course might be longer. But typically, it's about a week. Is this something that can spread and lead to more serious issues? It can, yes. Cellulitis can occur anywhere on the body, though it's most common in the leg. It can progress to involve the bacteria getting into the bloodstream or spreading to other areas. So, yes, this can be dangerous and should always be treated. Can your body fight it off on its own sometimes without antibiotics? Or does it always need medication? No. If it's relatively minor and in a small area, your body's immune system can sometimes handle it on its own. Thank goodness for our immune systems. But in many cases, you absolutely need treatment. One useful trick if you're at home and have a red area on your leg, and you're unsure how serious it is to use a pen to draw a line around the border of the redness. Then you can see if it's growing. If it's getting smaller or staying the same, it's probably okay. But if that area is spreading quickly, within minutes or hours, that needs immediate attention, you should probably go to the emergency room rather than waiting for your family doctor. That's one of the questions I always ask about any condition. Is this getting worse or better? That really helps guide treatment. Success rates and prevention. Is treatment always successful? Most of the time, it's successful. The duration of treatment is often adjusted based on how well the person is responding. Sometimes, it takes longer to resolve if there are complicating factors like severe lymphedema or swelling in the leg. But most of the time, it is successful. Cellulitis is quite common. It's one of the most frequent complications we see after surgery, simply because surgery involves breaking the skin barrier. We work incredibly hard to maintain sterility in the operating room, but sometimes cellulitis can still occur after a surgical incision. That's why your surgeon will be checking for it during your follow-up appointments. Can we do anything to reduce the chances of getting cellulitis? A big one is managing leg swelling. As people age, their veins and arteries might not work as efficiently, leading to swelling in the legs. Compression stockings, for example, can be very helpful in preventing this. Another common cause is athlete's foot, which is a superficial fungal infection. If you have any signs of athlete's foot, it's easily treatable with a topical antifungal cream. Remember, athlete's foot is fungal, and cellulitis is bacterial, so they're different infections, but one can definitely lead to the other. So, reduce swelling and maintain good hygiene. Keep your legs clean and dry. And of course, avoid surgery if you can, because that's probably the most common way I personally see cellulitis develop. We've even seen it after ankle fractures. The swelling and increased blood flow after a fracture can sometimes lead to cellulitis, which is tricky because the symptoms, swelling, redness, can mimic a fracture itself. Your doctor might often have to consider if it's just a fracture or if cellulitis has also set in, and then decide whether to add antibiotics to your fracture management. Now you know everything you need to know, and perhaps even more than you wanted to know, about cellulitis. If you have a comment, please leave it. Let us know your experience with cellulitis, because it's truly so common. You are 100% not alone. If you found this video helpful, please give it a like, subscribe to our channel, and remember, you are in charge of your own health. Thanks, Dr. Warren. Thank you. See you next time.